You know, the human heart is this incredible biological metronome. It just keeps ticking away, something like 100,000 times every single day. But what happens when that perfect rhythm just breaks? When the beat goes from a steady thump-thump to a frantic, out-of-control blur? Well, that's the highest stakes situation we're going to dive into. It's a question that every paramedic, nurse, and doctor has to face. When the heart's electrical system just goes haywire, the real challenge is restoring order, fast, but without making things even worse. And one of the key tools for that job is exactly what we're looking at today. So let's picture a condition like SVT, or supraventricular tachycardia. The easiest way to think about it is like a dangerous electrical short circuit in the heart. The normal signal gets trapped in this crazy feedback loop, and it causes the heart to race at insane speeds. It's an electrical storm, and you've got to find a way to calm it down. And that brings us to the hero of our story, Verapamil. Now, in this high-stakes electrical drama, Verapamil doesn't come in like a sledgehammer. No, it's more like a precision tool, a specific key designed to unlock the problem, calm that storm, and guide the heart right back to a safe rhythm. So what is this stuff really? Well, the textbook definition calls it a class 4 antidysrhythmic. That's just a fancy way of saying it's a calcium channel blocker. And that's the key right there. It works by stopping calcium ions from moving across cell membranes. It fundamentally changes the electrical rules of the game for heart cells. And here's the thing, it works fast. When you give it through an IV, it starts to kick in within just 1 to 5 minutes. But what's really interesting is how long it lasts. Only about 1 to 2 hours. That tells you this isn't a permanent fix. It's a powerful but temporary tool made for those critical, acute situations that demand perfect timing. Okay, so how does it actually do that? I mean, how does blocking a tiny little thing like a calcium ion calm down an entire racing heart? Well, it all comes down to basically becoming a traffic cop for the heart's electrical signals. So let's imagine the heart's AV node as a kind of gatekeeper, right? It sits between the top chambers and the bottom chambers. In SVT, electrical signals are just bombarding this gatekeeper, trying to get through. Verapamil steps in and very selectively blocks the slow calcium channels that this gatekeeper uses to open and close. By doing that, it slows down how fast the signals can get through. It breaks the chaotic feedback loop and lets the heart rate come back down to normal. It's not stopping the traffic completely, it's just enforcing a safe speed limit. But here's where it gets even more interesting. The super-targeted action on calcium channels has all these other ripple effects. It also dials down the natural firing rate of the atria, it slightly lessens the actual squeezing force of the heart muscle, and it helps relax blood vessels. All of these things together are why it's not just for rhythm problems, it's also used for things like chest pain and high blood pressure. All right, so we get how it works, but when do clinicians actually reach for it? Let's get into the official playbook, the situations where Verapamil is absolutely the right tool for the job. This right here is its prime time role in an emergency. For a very specific kind of rapid heartbeat called re-entry SVT, Verapamil is a go-to option, especially if the first-line drug, adenosine, hasn't worked. And beyond that main use, it's also indicated for a few other rhythm issues, where the main goal is just to get a super fast heart rate under control, like in certain types of AFib or atrial flutter. And like we talked about, it's also used to treat angina, that chest pain caused by spasms in the heart's arteries. Okay, for every green light, there has to be a red one. And with a drug this powerful, these red lights aren't just suggestions. They are absolute, critical, hard stops. Using Verapamil in the wrong scenario can be, well, catastrophic. And this is where the stakes get incredibly high. You should never give Verapamil to a patient with certain underlying electrical issues, like a faulty natural pacemaker, that's sick sinus syndrome, or an existing heart block. Why? Because it could shut down the heart's conduction system entirely. Same goes for patients with dangerously low blood pressure, or a condition called WPW syndrome, where giving Verapamil can tragically turn a bad rhythm into a fatal one. And this right here, this highlights the single biggest danger. If a provider mistakes a really dangerous rhythm from the heart's bottom chambers, that's ventricular tachycardia, for a less severe one and gives Verapamil, well, this quote from the source material says it all. The rhythm can deteriorate into ventricular fibrillation, and that is cardiac arrest. This is exactly why getting the EKG diagnosis right is so critical. So, with stakes that high, how is it actually given safely? This is where the nitty-gritty details of dosage and how you administer it become absolutely essential. For an adult, that first dose is given as a slow IV push, over at least 2 minutes. You can't rush it because that can cause blood pressure to totally bottom out. If that first dose doesn't work, a second, slightly larger dose can be given. Now for kids, it's all based on weight, with a very strict max dose, and it requires even more careful monitoring. You also have to be really careful about what other meds the patient is taking. For example, Verapamil can actually boost the levels of another heart medication, digoxin, in the blood. And if a patient is also getting beta blockers, the combined effect can slow the heart down way too much or weaken its pumping ability to a really dangerous point. And of course, like any drug, you've got potential side effects. Some are pretty minor, dizziness, a headache, maybe some nausea. But others are the very things you're trying to prevent in the first place. Severely low blood pressure, a dangerously slow heart rate, or even a complete heart block. This is why patients are watched like a hawk after they get this drug. One last really important thing to consider is its use during pregnancy. It's best to avoid it in the first trimester if possible, but Verapamil can be a life-saving tool for treating a racing heart in a pregnant patient when the other drugs just haven't worked. It's always, always a careful balancing act between mom's health and any potential risks. So what's the big takeaway here? Verapamil isn't some simple fix. It's this highly specific, incredibly powerful tool that can work absolute wonders in the right hands, but can be so dangerous when it's misused. It's a perfect example of that double-edged sword we see in modern medicine. Incredible power that demands incredible knowledge. It really makes you think, what does that constant balance between benefit and risk tell us about just how far medicine has come?